Most people believe a heart attack happens suddenly, without warning. One moment you feel fine, and the next moment everything changes. This belief is very common, especially among older adults. But in reality, the body often sends signals long before a heart attack occurs. The problem is not the lack of warning signs. The problem is that these signs are misunderstood, ignored, or explained away. People tell themselves it is just stress, just age, or just temporary discomfort. They wait, they delay, and sometimes that delay costs a life. In recent years, the number of deaths caused by heart attacks has increased significantly. Doctors often hear the same sentence after the event. There were signs, but we didn't think it was the heart. That is why this video is important. In this video, you will learn about the most common and the most overlooked warning signs that can appear before a heart attack. Some of these signs may already be familiar to you. Others may surprise you. And one of the most important signs appears in a place most people never expect: in the feet. As you listen, think about your own body. Think about your parents, your partner, or someone close to you. If any of these signs sound familiar, do not ignore them. And if you find this information useful, let us know in the comments. Simply writing "I'm listening" helps more people see this video. Let us first talk briefly about who is at higher risk. Some risk factors cannot be changed. Age is one of them. As we grow older, our blood vessels naturally become less flexible, and the risk of heart disease increases. Family history also matters. If someone in your family had heart disease at an early age, your own risk may be higher, even if you feel healthy. Heart disease is more common in men, but women are not immune. After menopause, the natural protection provided by hormones decreases, and the risk of heart problems rises sharply. Certain health conditions also place extra strain on the heart. Diabetes is one of the most serious risk factors. People with diabetes are more likely to develop narrowed or blocked arteries. This increases the risk of heart attacks, strokes, and sudden cardiac events. Stress is another powerful contributor. Long-term stress keeps the body in a constant state of tension. Blood pressure rises, stress hormones increase, and the heart is forced to work harder every day. Over time, this can push the heart beyond its limits. Now let us talk about the warning signs themselves. The most well-known symptom of a heart attack is chest discomfort. This may feel like pressure, tightness, heaviness, or burning in the chest. The pain can spread to the left arm, the neck, the jaw, or the upper back. In some cases, it becomes worse with physical activity. However, this is very important to understand. Not all heart attacks begin with severe chest pain. Especially in older adults, the symptoms can be quieter and more confusing. Some people experience nausea, stomach discomfort, or a sensation similar to indigestion. They may feel sick or uneasy without knowing why. Others notice a tight or choking sensation in the throat. Shortness of breath is another key warning sign. If you suddenly feel out of breath while doing something that used to be easy, this should raise concern. Unexplained breathlessness can mean the heart is not pumping blood efficiently. Dizziness or a feeling of lightheadedness may also occur. Some people feel unsteady, as if they might faint. If this happens together with heart palpitations, it should never be ignored. An irregular or rapidly beating heart is another important signal. If your heart feels like it is racing, fluttering, or skipping beats, your body may be warning you of a deeper problem. Unexplained sweating is also a red flag. Sweating during exercise or in hot weather is normal. But sudden cold, clammy sweating without physical effort is not normal, especially when it appears together with weakness or discomfort. Now we come to one of the most overlooked warning signs of all: swelling in the feet and ankles. Most people do not associate swollen feet with heart problems, When their feet or ankles begin to swell, they usually blame long hours of standing, warm weather, or simply getting older. Many people say, "This happens to everyone," and move on with their day. But in many cases, swelling in the lower body has nothing to do with age or fatigue. It can be directly connected to the heart. When the heart cannot pump blood effectively, circulation slows down. Blood and fluid begin to collect in the body instead of moving freely. Because of gravity, this fluid settles in the lowest parts of the body first. That is why the feet, ankles, and lower legs are often the first places where warning signs appear. This swelling is usually more noticeable in the evening. You may take off your socks and notice deep marks around your ankles. Your shoes may suddenly feel tighter than they did in the morning. Your feet may look puffier or feel heavier than usual. Many people see these changes every day and never question them, but these small details can be the body's early way of asking for help. If this sounds familiar to you, pause for a moment. Think about how often this happens. Has it been weeks? Months? If you have experienced this, write "feet" in the comments right now. Your comment may help someone else realize they are not alone. Many people live with this symptom for a long time without understanding what it means. They buy larger shoes. They loosen their socks. They elevate their legs at night. But they never stop to ask an important question. Why is this happening? And more importantly, what is my heart trying to tell me? Pain or cramping in the calves while walking is another sign that deserves attention. Some people feel tightness, heaviness, or aching in their lower legs after walking short distances. They assume it is muscle fatigue or poor circulation in the legs. But this can be a sign of reduced blood flow caused by narrowed arteries. It is not just a leg problem. It can be connected to the heart and the blood vessels that support it. Heart attack symptoms can also appear differently in men and women. Women, in particular, may not experience strong chest pain. Instead, they may feel discomfort in the back, jaw, neck, or stomach. They may feel unusually tired, nauseous, or unwell without a clear reason. This difference is one reason heart attacks in women are sometimes missed or treated too late. If a heart attack begins, certain actions can make the situation worse. Remaining on your feet places additional strain on the heart. Sudden exposure to very hot or very cold water can be dangerous. Cold water, especially, can cause blood vessels to tighten and increase stress on the heart. If you suspect a heart attack, seeking help immediately is critical. If you are alone, opening the door and sitting or lying down can help emergency responders reach you faster. Eating or drinking should be avoided. Every minute matters in these situations. Remember this carefully. Some warning signs feel mild. Some appear slowly over time. Some come and go, making them easy to ignore. But when it comes to the heart, there are no unimportant symptoms. If you recognize any of these signs in yourself or in someone you love, do not wait. Talk to a doctor as soon as possible. Early attention can make the difference between life and loss. If you are still watching, write "I watched until the end" in the comments. Also tell us which symptom surprised you the most. Your interaction helps this video reach more people who may need this information today. Please like this video and share it with your family and friends. Subscribe to the channel for clear, simple, and practical health information. Your body often whispers before it screams. Learning to listen in time may save a life.